Hi, I'm Dr. Michael Marshall from Veterinary Wellness Center in Boise, Idaho. And today we're going to talk about a couple of feline viruses, those being the feline leukemia virus, or the FeLV, or the feline immunodeficiency virus, which is the FIV. So they are definitely similar in some ways. Some of the main similarities is that they're both called retroviruses, which means it's a type of virus that once they get, they cannot get rid of them. Both of them work as immunosuppressants to the system. They can cause their own diseases, but they're also making the patient much more susceptible to other diseases. And a lot of times we will see them in strays, places where cats congregate, shelter cats, a lot of times will have it as well. So the differences. Well, the feline leukemia is sometimes called the kissing cat disease. And that's basically because it's spread just through grooming, simple grooming, licking each other, spreading saliva. Sometimes they're eating out of the food bowl, the same food bowl, or drinking out of the same water bowl. That's a good way that they can spread it. So when it's in the body, a couple things can happen. Not only is the immunosuppression, but they can also be susceptible to what's called lymphoma, or also myelosuppression, which means that they may be anemic because they're not making enough blood cells. It can be tested for pretty easily. I recommend that every patient that comes in, kittens are tested if they're not already tested by wherever they came from. Simple test, and pretty inexpensive. We draw some blood, and with the feline leukemia, what we're looking for is the antigen, which means we're actually looking for the virus itself. Now, once a cat is tested and found to be negative, if they're going to be going outside, they definitely should have the vaccine. The feline leukemia vaccine is pretty effective. So, like I said, good thing they can get it. Now, if a cat is under high pressure with a lot of cats that are random, that may have it, they still may be susceptible, but again, they should be protected if they're going outside. FIV, the feline immunodeficiency virus, very similar, but sometimes that's called the fighting cat disease because a lot of times it's spread by deep wounds. So with that happening, male cats are a little overrepresented in this. Now, cats with FIV, again, immunosuppressed, sometimes they're poor doers, they'll run a fever, they have poor hair coat, not doing well. The test is the same test as the feline leukemia, a little bit of blood, except for this time we check for the antibodies. With antibodies, they can be spread to the mother. So if a young kitten is tested and they are positive for the antibodies for FIV, recommend that they're tested about 6 months later to make sure that they are negative, because sometimes they just get rid of the antibodies and they're actually doing all right. There is no vaccine for that one. But the same thing that comes up with both of these viruses, they should be, if a cat is positive, they should not be exposed to other cats. So you should be in a one-cat household, or I suppose you could do it if the other cat is already contracted the disease as well. And they need to be protected. They need to be inside so they're not getting susceptible to other diseases. And anytime they're sick, they should come in. We'll treat underlying symptoms, whether it's antibiotic or however we want to do it. So that's the rundown on the feline leukemia and the FIV. Please like us on Facebook at VWC Boise, and we will see you next time.